afternoon, everybody. I'm just letting you know that a male in his 30s tested positive for COVID-19 after close contact with someone outside the region who has the virus. He is a resident of Oxford County. The individual was assessed, tested, and released by the Woodstock Hospital, where all appropriate infection control precautions were followed. He is now in self-isolation at home and being followed by the Southwestern Public Health Unit. We are following up with any contacts of the individual by telephone. You will receive, the individual, any contact will receive a telephone call from our infectious disease team if they were identified as a close contact. And just a reminder to all the listeners that the best way to prevent the spread of respiratory viruses is to practice social distancing, staying at least 2 meters apart, washing your hands often with soap and water or with an alcohol-based hand rub. Stay home if you're sick. Clean and disinfect high-touch surfaces daily. And those are the key messages. And I'll open it up now back to Natalie.
Thank you. We have our first question from Chris McMillan of Heart FM. He would like to know which area of the county the case is from.
The information that I have at this point in time is Oxford County.
Chris would also like to know, what should people do if they feel symptoms? Do we have testing centers set up?
The Woodstock Hospital's testing center has been approved and is just waiting the green light. Currently, there is still capacity for getting testing done within the hospitals within the Woodstock area. So I think the ministry will provide guidance as to when it would be appropriate to open the assessment center.
Thank you. We had a new caller call in. Can you identify yourself?
Hi, it's Alvin from CBC London.
Thanks, Alvin. We have our next question from Rob Perry, Elmer Express. He asks, given that both cases have involved men in their 30s, is there any correlation between the two, such as both having close contact with the same infected person from outside the area, or is this just a coincidence?
This is just a coincidence, Rob. As far as I know, neither knew each other or were connected.
I'll open it up for a question from John Payne, Rogers TV Woodstock.
Good afternoon, Doctor. Just curious what type of symptoms this man would have presented with.
Let me see if I have. I don't have those details. I think he began to feel unwell, and because he was a contact of another individual, he was aware that he needed to be assessed if these symptoms developed. I understand that the individual is self-isolating at home, so not sick enough to require hospitalization.
Thank you. Our next question will be from Shane from Rogers TV.
The patient was assessed on March 20th, and he's been self-isolating since then. So my staff here will be interviewing the individual to determine the period when that individual would have been infectious and to identify the contacts of that individual when he was infectious. So the timelines will be determined and used to connect with the contacts. So the general public, if they don't hear from public health, are not at risk.
Our next question is from Greg Colgan, Woodstock Sentinel Review.
Hey, thanks so much for making the time for this. You mentioned earlier that the Woodstock Hospital was approved for a testing center. When are the estimates for that to be open, and what will that testing center be like for people to come in and possibly get tested?
So it's not a testing center, it's an assessment center. So assessment means that the individual will be seen by a qualified health care provider. The healthcare provider will determine what is best for the care of that individual, and then so that does not necessarily include testing. It may be limited to instructions as to how to best take care of themselves and when to present to a healthcare provider again for further assessment. Under specific indications, they may be tested or referred for testing. And in terms of when it will be opening, I understand it's ready to go, and that the Woodstock Hospital is awaiting the green light from the Ministry of Health. And for further details, you'd have to ask the Woodstock Hospital.
And do you know is it going to be a similar setup to, say, like London, where they have kind of the drive-by assessment centers, or will it take part in a different area of their building?
I understand that it's in a different part of their building, but I would suggest that for the depth of those details, you ask the Woodstock Hospital.
Okay, thank you.